Hi friends, again welcome back to my channel. Friends, here we can discuss previous year questions from ESIC, also from RRB question papers. First question we can see the major priority of nursing care for a child suspected of having meningitis is. Options: Option A, check temperature and give cold sponging. Option B, isolate the child immediately. Option C, administer antibiotic as soon as it is ordered. Option D, restrain the child to prevent accident. Here question, what is the priority or first nursing care for a child diagnosed with meningitis? It is isolate the child immediately. Option B is the correct answer. Meningitis is the inflammation of arachnoid and pyometer of the brain and spinal cord. Okay, it is the inflammation of brain and spinal cord. Here, this is mainly caused by bacterial and viral organism. Maybe bacterial meningitis or viral meningitis. Transmission of this meningitis is mainly by direct contact, including droplet spread. Okay, so immediately once the baby or once the child is diagnosed with meningitis, we should isolate the child. Okay, and the next nursing priority is can give antibiotic as ordered by the physician. The first care is isolation. And the next question, which type of precaution should the nurse implement for a child diagnosed with septic meningitis? Options: Option A, airborne precautions. Option B, contact precautions. Option C, droplet precautions. Option D, none of this. Here the question is, which type of precaution? Which type of precaution means safety measure does the nurse implement for a child diagnosed with septic meningitis? So the correct answer will come. It is droplet precaution, option C. Meningitis can spread through the droplet infection. So the precaution should be continued 24 to 48 hours after the administration of antibiotic therapy. The next question, a person with schizophrenia was found to repeat the words that the nurse was speaking. This type of behavior can be called as. Options: Option A, echopraxia. Option B, neologism. Option C, echolalia. Option D, word salad. Here the question is, the patient is repeating the words that the nurse was speaking. So the repetition of words or repetition of the speech by imitation is known as echolalia. Option C is the correct answer. Echopraxia, the first option, that is the patient imitate the activities done by any other person or the nurse. That is known as echopraxia. Here echolalia means repetition of the words. Echopraxia means repetition of the activities. And the next question, in the liver, bacteria that found their way to portal circulation is destroyed by. Options: Option A, cilia. Option B, hydrochloric acid. Option C, leukocytosis. Option D, Kupffer cells. Question, in the liver, how the bacteria is getting destroyed? Correct answer, with the help of Kupffer cells. Option D is the correct answer. Kupffer cells are specialized macrophages located in the liver. It helps to prevent the entry of bacteria into the portal circulation. Okay, they are macrophages. Macrophages means one of the important blood cells which helps in the immune mechanism. The next question, which artery supplies oxygenated blood into the stomach? Option A, carotid artery. Option B, gastric artery. Option C, celiac artery. Option D, cephalic artery. The artery which supplies oxygenated blood into the stomach is option C, it is celiac artery. The next question, neurologic conditions characterized by paroxysmal recurrent neurological discharge from nervous tissue resulting in seizures is called. Options: Option A, simple febrile convulsions. Option B, typical febrile convulsions. Option C, acute convulsions. Option D, epilepsy. Questions, once again I'll read. Neurological conditions characterized by paroxysmal recurrent neurological discharge from the nerve tissue result from seizures is known as epilepsy. Epilepsy is characterized by loss of consciousness, convulsive movement and other motor activity, sensory phenomena and behavior abnormalities. Here it is correct answer option D, epilepsy. And the next question, generalized tonic-clonic seizures in childhood are called. Option A, petit mal seizures. Option B, grand mal seizures. Option C, bilateral seizures. Option D, atonic seizures. Generalized tonic-clonic seizures in childhood are called grand mal seizures. Option B is the correct answer. Move on to the next question. Simple or typical febrile seizures occurs in options. Option A, infants below 3 months of age. Option B, 3 months to 5 years. Option C, 5 to 8 years. Option D, pre-adolescents. Simple typical febrile seizures occurs in 3 months to 5 years. Option B is the correct answer. Febrile seizures or febrile convulsions are the type of tonic-clonic seizures. It is mainly occurs between the age of 5 months to 5 years of age. Here it is 3 months to 5 years is there. So that is the correct answer. And the next question. The nurse teaches the parents of a child with fever, headache and stiff neck that the test used to confirm the diagnosis of meningitis is. Options. Option A, blood culture. Option B, peripheral skin smear. Option C, lumbar puncture. Option D, CT brain. Here the question is, which test is used to confirm the diagnosis of meningitis? Okay, so the first, all the symptoms, fever, headache and stiff neckness are the symptoms of signs and symptoms of meningitis. So the test is option C, lumbar puncture. Lumbar puncture is done to remove CSF fluid, that is cerebrospinal fluid. Position for the procedure is C-shaped position and the site is between L3 and L4 vertebrae. Normal CSF pressure is 6 to 13 mm Hg or 80 to 180 mm of water. The next question is one image. Identify the image shown in photographs. It is a red rubber catheter. It is mainly used to manage retention of urine. If the patient is having urinary retention, then we are using once. Then after urine is emptying or the bladder is emptying, then we will throw the catheter. That is, it is used only once. The next question also one image. Identify the image shown in photographs. Okay, this is a biopsy gun. So here in this video we discuss important questions for ESIC. This all previous year questions and also important questions for ESIC, RRB and DME exam preparation. If it is useful for your studies, you can share my videos to your friend circle and also subscribe my channel.